Overall, Merida is really healthy. She is very much a normal cat, aside from her mobility concerns and some of the things that go along with that. But she is aging very normally and healthily, and is a happy, good girl. Merida was diagnosed with something called cerebellar ataxia, which means that the part of her brain, or her cerebellum, that coordinates her body movement has been injured, so she has difficulty getting quite the level of coordination required to be able to walk independently, although she's shown significant improvement over the years and continues to gain strength. She does need assistance with that. Additionally, she does have some dizziness issues that make it a little bit difficult for her to hold her balance as well as her body position independently. She doesn't have an exact diagnosis. She was diagnosed with cerebellar ataxia, but as far as exactly why that occurred is an open question. It's suspected to be a traumatic injury when she was very small. Early x-rays of her did indicate she had a little bit of spinal injury as well. She had a subluxation or a slight displacement of 2 of her vertebrae. The answer is no. She's having a small dizzy spell. So she's having an eye movement called nystagmus that is a natural response to her brain injury and to some of the dizziness that can occur. So much like getting off of a merry-go-round when you've been spinning too fast, that's what she experiences in short bouts. But that's shown significant improvement over the years. So she's showing me just a little bit right now, but it's not too bad, and she's quite used to that. So it doesn't seem to bother her significantly. It just takes her a moment to rebalance. Absolutely, yes. When Merida presented as a very small kitten, she was so dizzy that she had a hard time even sitting upright and required a pretty significant amount of support for her basic functions. And now she is much more independent and is able to exhibit some very normal cat behaviors. And clearly she doesn't have any type of mental disability. Like her cognitive and thinking ability are very normal. Her emotional ability and her ability to interface with her caregivers and her friends is very good. So she's come a long way. And the answer to that is we felt like she deserved a chance, and although her quality of life may have appeared to be pretty concerning in the beginning, if you took a little moment to assess that and to give it a try with some of the tools that we have, including just some basic acupuncture, and to see that her caretakers were committed and able to provide her with the kind of nursing care and support that she required when she really needed a lot, it seemed like the right thing to do to give her a chance. And she certainly met and exceeded our expectations on how she might be able to do. And over 10 years, she's developed into a very happy, now middle-aged cat, doing pretty well. Absolutely, she does come in for maintenance appointments because she works so hard to get around and gain strength, even though she's doing much better with that over the years. It's very easy for her to get a little bit sore, especially at the site of her previous injuries, and to develop some muscle spasm or some muscle sprains or strains or some spinal stiffness. So it's really good for her to come for maintenance care to make sure that we can help her with those things. She has in the past gone through some periods of difficulty with the regularity of her urination or bowels. That's in really good shape right now, but she has needed some assistance with those things in the past. So she does require some medical maintenance care, but overall it's easy to provide for her. And most of the work that goes in keeping her healthy and happy and fulfilled is done at home with her family. I feel like her home support is a lot more than a normal pet, but nothing from a veterinary medical standpoint is too extraordinary. We're just doing some basic supports as needed. We're watching for what she needs as things arise, and then some maintenance care involving things like spinal manipulative therapy and pain control when needed, some dietary alterations or some supplements, some acupuncture, and then routine medical care such as monitoring blood work and vital parameters and dental health, etc. So there's just one extra layer in there to keep her going. I think her daily quality of life is very good. This is the existence that Merida has known since kittenhood, and she can become sore periodically, but not significantly painful, and we're very mindful to manage that. All of her needs, her basic needs are being met, and then above and beyond that, she's got a very active social life. She's got a great relationship with her family and her caretakers and friends that come visit. She enjoys her outings. She loves playing and watching birds, and she loves her food. So I would say her overall quality of life is really good. Merida is a very smart and cognitively normal cat, and she is able to express like a normal range of cat emotions and behaviors. She's got a very big personality that she's able to express. And most of her normal cat things she is able to do just with some assistance. We've been friends for a long time, and she's a real heartwarming patient to have because she's really generous and affectionate, and sometimes she'll give me kisses and purrs and cute little positions, and it's nice to see that she's happy to see me when I'm happy to see her, and it's been really nice to watch the progress that she's made over all of these years. We're really proud of what she's done, and it's just nice to see how comfortable she can be with the appropriate assistance. She is a little ray of sunshine, and there can be hard days in veterinary medicine, and it's been really nice to see her walk through the door sometimes to come brighten up the clinic and share her affection with me and with my staff, and just act cute as a button like that. And I really appreciate the trust that she gives us, and it makes me feel really good that we can help her be more comfortable, and she seems really generous with being thankful for that, and just with sharing her personality with us. And now she's gonna go to sleep.